and we've kind of been plugging away at that. And your referral system was a great idea, because part of access to care is just getting the patient and the PCP to connect with the specialist. And unlike some specialists who are overwhelmed, we positioned ourselves so that we can intake and build a big enough infrastructure to take responsibility for that community, the critical limb ischemia patients. So here we are now. It's been a little while. I'm actually, believe it or not, sitting at the Whalers in Maui. I came out here to hang out with my parents for the weekend, and we're actually starting our first case in Maui on Tuesday in our Maui facility. We're actually also getting privileges at Maui Memorial so that we can properly help the patients here and just really have a presence. We're setting up a call schedule so we can cover the weekends and help Dr. Parsons. He's kind of the part-time vascular surgeon who lives here. So we have a great relationship, and really excited to complete this kind of final phase of statewide practice. So on Tuesday, when we finish our first angiogram cases, that's going to be a big deal for us. And then regarding kind of this global idea, it's just in the last year or two, we've been doing a lot more education where people come over from, places like Japan, Australia, Singapore. And a lot of it is industry related. We do some teaching. I've been on faculty with some of the bigger companies for about 5 years. And I do a lot of the training of the docs and the reps so that they can safely go out and teach others how to do these procedures and when not to use the devices, the proper indications. And as we've done a nice job in Hawaii, they've sort of asked us to partner. Various groups have asked us to partner with them to help them establish vascular care, and mostly in rural settings like Fairbanks, Alaska. We have an office there where we do procedures, and Yakima, kind of east of Seattle in Washington, where we have a growing practice. So now it's just it's a matter of sharing what we've learned in terms of offering remote vascular care, or care where in these areas in the U.S. they call like vascular deserts, where we don't have specialists, and we've found ways to efficiently take care of the whole community. So that's what we're trying to scale. In terms of Saudi Arabia, I understand there's kind of a growing relationship with the health ministry there, and you may have some opportunities. So we're just kind of piggybacking off of that to see if there's anything we can offer to make it kind of a more robust position for you folks in terms of setting up your referral networks and also providing education. That's really the big thing that's missing in vascular. Not just education of patients and primary care docs, but also specialists. There's been a revolution in vascular care. And in the last 15 years or even last 5 years with the advance in technology. So we stay at the cutting edge and the forefront of that, and that's how we position ourselves to help train the others, and there's a lot of interest in that. And, being half Egyptian, half British, I speak a little Arabic, so I can talk to those folks in Saudi Arabia and just offer our services.
Okay. Have you done any of the vascular surgeries in Saudi Arabia?
No, I see. I don't have any experience over there.
Okay.
It was just,
S- how does the idea that I mean, how many patients do you think we should aim for the next 3 months that that you will go
patients,
there
and
and see them? Like, what's the
it's a
minimum
difficult.
that will be worth it for you? So I aim for that
It would,
measured number.
if I went there, I would go for a week and try to do 20 patients.
I see.
Proceed.
So my OKRs, my key results should be Dr. Amr to see and treat 20 patients by end of this year, basically quarter four, so 3 months by the new year.
Yeah, but Nora, the thing is, there's different ways to set it up. Either I know there's folks over there, and maybe they've got it covered, or maybe they want someone to come and help. What they would do is they would line up the patients, and then we would do it together. That way, it's kind of like an on-site training course. And then we could get industry to help sponsor that and bring their devices in case they don't have it over there. And so it's a nice thing for them, a nice service. Or If there's really like a need and a lack of care, then the other providers can coordinate with us telehealth, and we can see the patients and line them up so that when we go there, we can go and just take care of them, just do procedures. Because if I go out there, I shouldn't really be taking that time to do consults. I should be operating, and a lot of that consult work and kind of getting the patient ready, we can do remotely.
Yeah, yeah, yeah. That's the goal. That you, when you're there, you're only operating procedures and resting for the week.
I'm not sure how they're structured. Like the Saudi Health Ministry, do they employ doctors and or is it more like a little bit hybrid model where it's the universities and private practice that run the care there? I'm not too sure. I could talk to some folks and find out.
Who are the
Well,
folks? Because I'm talking with people in
well
Saudi too. Maybe by.
no, it's just mentors. He's done work like this in Jordan with the government there. So he would go out there and take care of patients. So I'm not sure. I want to see how they structured it. Um, but that's basically the idea. So what? How's your discussion going with them, Nor? Are they? Is it just because one of your partners is from there and you want to kind of get something going there, or was there some other opportunity?
Yeah, yeah, it's mainly because of the partner, Ahmed Thnayan, which was on Ramadan, last Ramadan, we did this pitch, and then he believed in the care coordination idea in April,
Okay.
basically. Yeah, April, April, we did this pitch. He liked the team. Then we signed contract that he is exclusive partner, not just for Saudi, but for something called MENA region. And MENA
Yeah.
region include Saudi and Dubai, I believe, and UAE and other countries there. Maybe Egypt also. I'm not sure
Oh,
if it
cool.
does. So he's the exclusive partner, and because he's the exclusive partner, obviously he wants us to grow there. Um, he is, if I remember correctly, he used to be the Ministry of Communications and Innovations, and he knows a lot of the health centers and hospitals. I lived in Riyadh, so I asked him about few health centers I've been to, and he, according to him, he knows the decision makers there. So if we have a product that work, we will be able to put it there.
That's great. Get like a government contract or something. Um,
Yeah,
yeah. So yeah, talk to him and find out what the infrastructure is and what the interest is. I mean, maybe there's no interest in us coming and doing specialty care there. You know, they have a lot of Europeans and Americans. They go there and they work. It's the King. I forget.
German Saudi hospital,
Yeah, yeah. There's a King
King
Faisal. Or,
Fahd and King
yes,
Saud, probably. Yeah.
yes.
So the member that couldn't join us today, Dr. Zaki, he knows the
Yeah.
industry there also very well. He built the main software for King Saud University for telehealth, and he has a
Oh
lot
wow.
going on there. He like give presentations in major health events in Saudi and Middle East. Um, family emergency, so he couldn't join. Um,
You know, there's a conference in Dubai, October 13th or something like that. It's a big vascular conference, so it could be an opportunity to do some networking. I don't know if anybody's going over. I thought about going, but
okay.
we'll see.
Um,
I'll talk to a friend and then see.
okay, cool. I send me a link if you find it. I'll try to look it up also. Maybe we
Yeah,
can make it as part of the milestones. So obviously Rebecca, she's great at doing triaging for what you do. So she will be able to do the triage for these patients. We line them up, and then you go there, you do the surgeries, and then maybe we do the continuous care as well, like the follow-ups, and obviously
yeah,
we build the system software so all of this can scale after this pilot phase. So for the next 3 months we're going to try to figure out the legality of stuff, your travel, how convenient it is before we bring other doctors. Yeah, because we're piloting the idea with you being like already knows us. um, yeah, or
yeah.
mhm.
Well, nor there would be a full protocol for me to do the triage for Amr. We would set something up, but that would be very detailed. So, yeah.
Yes, Yeah.
Yeah, I'm not trying to build a practice in Saudi Arabia.
Yeah, right. Exactly. Yeah.
Learning from those guys what they do, we
Uh-huh.
can show them what we do. Leave some knowledge and then that can be used there in that country. That's all. And then if that goes well and it's a good brand, then we can go to other countries and just repeat. To me, that would be kind of a personal goal.
The way I'm seeing it, telemedics is your practice in Saudi Arabia and others. And you're, I don't know how we're gonna figure it out legally wise. Maybe you're employed at telemedics, practicing in Saudi, and we scale this way. Like this is where telemedics need to fit to make it so
Well,
easy for specialist Americans to practice in
yeah.
Saudi seamlessly. So a lot of legal stuff we have to figure out.
Well, if you're practice, then we gotta consider billing, coding, management, employees, all that crap. And the way I've been doing it is I have my own corporation that's basically the physician-led group, Pacific Vascular Associates, and at least in the U.S., because of the corporate practice of medicine laws, it works out really well that the physician group's separate, and then you just consult them. So we would just charge a consulting fee for our services. Then we don't get involved in self-referral issues, and we basically come in and take care of the professional services.
Right. If telemedics can be the go-between or the communication product, that would keep us somewhat out of the legal aspects as well.
Yeah, TeleMedicX would basically have the platform and hold the practice. It would be basically the platform that we use to deliver care. And then I'm assuming Hardeep would ask for some kind of management contract if he wants to manage it, or he could hand over the management to TeleMedicX. And then I would come in with the clinical piece.
Okay, these are like the details, which most
Yeah,
likely
just
this what will happen. The
yeah.
vision, same as Airbnb, is now the biggest hotel in the world. I want telemedics to be the biggest hospital in the world. By
Like
just like Airbnb is for hotels, telemedics for specialist hospital, largest in the world.
Well, when you think about it, Norn, Airbnb is really a communication device where it offers services. It offers a connection between people who want to rent their houses to people who want to rent them, right? So it's a communication product. It's not really the hotel. So it's if you're thinking that communication, I agree with telemedics continuing to be the communication of the go-between, and I think that would work really well as a hospital and such. And I think you're looking into a huge amount of liability and legalities and such that I don't know that we're prepared to get into. But I think as a communication product, I would like to stay in that arena. Just stating, not pushing hard,
yeah,
just commenting.
it's a huge difference. I agree. I mean, Nora, I think a good position for you is to be the platform, and then you get people to. You just have smart lawyers that make contracts, and you get folks to sign on. And if it goes well with me, and I'm specialist, and I just can drop everything, come out, do cases, and the EMR is very organized, and there's some kind of follow-up plan, all these things that the docs would worry about. And you try to keep the liability on the docs if you can, then you're just a platform that they can use that patients can access specialists from around the world. So we would pilot it, and then we would just repeat that for like urology, ortho, spine,
Cool.
you know.
That's a plan. We all kind of see the direction of the vision. Um, all right. What is next then? So I hear from you the interest to be part of this pilot. Um, you're gonna help us figure it out. Okay, fantastic. Next step. Let's see what is next step. Um, put this in pitch because I'm presenting in Saudi in few weeks. So before this meeting, I had a meeting with the Saudi team for branding and the pitch deck, and this is why I was working on presentation for this meeting, and then it's half done. Why I'm mentioning this? There is a pitch deck being prepared for my presentation. Some of the comments I got that I need to state more clearly with numbers what is the problem we're trying to solve. So it sounds like patients in Saudi are not able to see experienced specialists because of not enough specialists in the world, especially in Saudi. More patients need vascular surgeons, but they don't have it. So we're solving it using this platform that people like Dr. Amr are able to go there profitably, do the work fast and efficient way and out. And then we scale it. So why I'm mentioning this, this is the next step. I will be working with Rebecca and maybe you by email to put, and Hardeep is genius at writing. So you, Hardeep, and Rebecca, we will state it with numbers. What is the problem we're trying to solve, how we're solving it, and what's the potential for this to scale to, maybe we first contain it into vascular specialist and show more potential if we scale to other specialists. Maybe wound care, maybe oncology, but we stay first focus on vascular. Hardeep's strength is vascular, right? His businessman.
Yeah, he's done ortho and surgery centers and all kinds of things. But yeah, we also have to identify which countries at the most need of those countries that you mentioned, because it might be like if it's just going for Saudi, if it's not, maybe they have surgeons there and they don't want someone to come in and do the cases. Who knows? I want to go where there's a need. I don't want to go compete with someone. You know what I mean?
Right.
Always
And a need and a need for training of the most up to date tools and such. So that's what
yeah.
you're doing right now, currently, right, Amr?
Look, the way we came to Hawaii, I came and shook hands with every vascular surgeon here, and I said, "Where's the need?" And they were like, "Okay, we have guys in town. We have guys here. We have guys there. Oh, Dr. Harada out west, he's really struggling. He's got too many patients, and he needs help. His partner just left. So that's why I ended up in West Oahu, and that's why we went to Big Island in Maui, because we needed it, you know. And that worked out well for us, and it was always felt good to do that. You don't want to step on toes, you know.
Right.
Don't need to.
It
Okay.
seems like Saudi is really expanding though, and been a very positive expansion and push for innovation and such. I just don't know where they are either, as far as where they are in the vascular world.
Yeah.
Would it be as simple as a Google search, Honor, to find out what we need to find out as
I,
far as that goes?
I will talk to the folks there. I'll touch with the surgeons there. That's no big deal. But
Mm,
but yeah, you just made me realize that we don't want to get in trouble with Prince Salman, whatever his name.
right.
No, they're my friends.
Yeah.
They're our friends. We got the partnership, so no, we're cool. Don't worry. You're not Khashoggi. You'll be fine. Um,
Comments.
um, cool. So you mentioned that you will ask the people. I know Dr. Farhan Ayubi, he's joining you guys in PVI, no? Or he already part of it?
He's got a couple of years in the. He's over at
Veterans and
Walter Reed. Yeah, he's over at Walter Reed, so he's across the
sick.
country, but he's back and work with us. So I think he has about 2 more.
Okay, very far. 2 more years. That's a lot.
Yeah.
Okay. Do you know any? Well, I'll connect with people in the Ministry of Health. Noura was supposed to. Well, it's still the plan. She's gonna talk with me about competition, marketplace there in Saudi. She's part of the Ministry of Health, so she knows the competition. But my idea was about the e-consult. Now we're kind of pivoting into e-consult plus bring the doctors there. So I'll find the legal stuff on my side within 2 weeks, and I'll reconnect with you in less than 2 weeks. Um, you two do some research if you have time or access to people.
I'm gonna call some people.
Cool.
I'll call some people. No, sir.
I'll keep you updated on email. This is exciting, and thank you, Amr. If anyone has any question, go ahead. Nothing else from me.
Yeah.
Okay, great. So at some point when we've got, so working with, I'll bring you up to date, Amr, the University of Hawaii, we're working with a mental health group that is offering, they're providing free services. And so we're tooling the EHR right now for the mental health arena, but it's already in the general practice clinic setting as well. It's a really good telehealth setup. And then we can add, you know, vascular and such into that as well. So probably be getting with you later on to do some tooling.
Yeah, let's take a look at it. We kind of left it, and then we can pick it back up.
It's a good product. It's much better than what we had before.
Yeah.
It's comprehensive. You'll like it.
Cool. Well, my new office is set up, so we need. I'm just giving talks now and getting the new fax number out, basically.
Is that in Maui? New office in Maui?
At PVI across the hall, I bought a space. Okay.
Oh, okay.
So instead of seeing the patients in Gerardo's office, I'm seeing them in my own office because we're going to focus on CLI instead of renal failure.
Okay.
So I need to get that new number out. Otherwise, we'll miss referrals. Yeah.
Right.
Yeah.
Okay.
Yeah. Thanks, guys.
Cool. Thank you. Howard, do you want to add anything? Or
No,
no? Okay.
I'm fine. Thanks.
Super. Thank you, everyone. Aloha, salam, bye.
Have a great week. Bye.
Bye, guys.
All right. Thank you.